Welcome to this explainer. So, today we're tackling a deeply frustrating biological mystery. You know that feeling when your back or leg pain is finally gone, thank goodness, but the numbness, yeah, it just won't quit? If you've ever found yourself thinking, well, I guess this numbness is just permanent now, trust me, you are definitely not alone. We're going to break down the exact science of nerve healing today so you can see what's really happening under the surface.
Okay, let's dive right into this highly anxiety-inducing question. Because, let's be honest, it is incredibly common to panic when that sharp, shooting pain finally subsides, but you're left with this heavy, dead, or kind of tingling sensation that just hangs around. You instinctively think, right, the nerve must be completely dead. Well, today, we're validating that frustration, but we're also going to explain exactly why lingering numbness does not automatically mean your nerve is ruined. The honest truth? It's not a simple yes or no. You see, the way your body heals pain is completely different from the way it heals numbness.
When we hear the phrase permanent damage, our minds instantly jump to the absolute worst-case scenario, right? We panic. We think of a total loss of feeling, or worse, complete paralysis. But the research actually tells us a totally different story. In routine lumbar nerve compression, true, total nerve failure is really uncommon outside of severe neurological emergencies. What permanent usually means in this context is just partial recovery. It means you might have some residual symptoms left over, maybe a lingering numbness, a tiny patch of skin where the sensation is just a bit off, or some occasional tingling. The nerve absolutely still works. It just might not work exactly the way it did before it got pinched. And the breakdown of nerve damage brilliantly illustrates exactly why your symptoms morph and change over time. Modern nerve compression research gives us a really helpful timeline here. In the very first stage, early irritation, the nerve is just swollen and inflamed, and that causes your burning shooting pain. In the second stage, the myelin, which is basically the protective insulation wrapped around the nerve, that gets damaged, and that's what gives you those super annoying pins and needles. Finally, in more severe compression, the actual nerve fibers themselves are injured, leading to persistent numbness and weakness. So different parts of the nerve literally heal on vastly different timelines.
So here is the absolutely crucial point to take away. Pain recovery and numbness recovery are running two entirely different races. Pain recovery is tied directly to inflammation. When you relieve the pressure on a pinched nerve, that inflammation can calm down relatively fast, sometimes in just a matter of weeks. Numbness, though, totally different beast. Numbness recovery is tied to the agonizingly slow biological process of structural repair. Your body literally has to rebuild that damaged myelin sheath, or even tougher, regrow the core sensory fibers from scratch. You're waiting on microscopic construction here, not just a simple drop in swelling.
Now, I want you to keep this single, absolutely incredible number in mind. 1. Just 1. This actually represents the speed of nerve recovery. According to the research, under favorable conditions, damaged nerve fibers regrow at roughly 1 millimeter per day. Let that sink in for a second. 1 millimeter. That is unbelievably slow. Now sure, this number isn't a perfect predictor for every single person, but it's a massive light bulb moment for understanding exactly why nerve healing takes months rather than days. Just think about your own anatomy for a second. A lumbar nerve doesn't just stay put in your lower back. It sends signals all the way down your leg, sometimes literally all the way to your big toe. Now do the math on that. Rebuilding a biological pathway that is hundreds of millimeters long, from your lower back all the way down to your foot, at a rate of 1 millimeter a day, that is a massive journey. If the main injury is just to the insulation, sure, recovery is faster. But if those core fibers need to physically rebuild down the entire length of your leg, well, that's a major structural project that demands incredible patience. Okay, let's shift gears for a second, because we need to completely debunk that terrifying 6-month rule you might have read about on internet forums. You know the ones, claims that if a nerve isn't fully healed in 3 months or 6 months or a year, the damage is just permanently locked in forever. Well, the nuance here really matters. Yes, a shorter symptom duration can be associated with a faster recovery, but research on lumbar decompression actually shows that patients with symptoms lasting way longer than a year can still see highly meaningful improvements. So the calendar is absolutely not a hard, inflexible deadline for your nervous system. Rather than just helplessly watching the calendar tick by, your actual potential for recovery depends on some very specific, measurable factors working together in your spine. Like how severe was the compression? Mild compression bounces back way faster than severe compression, obviously. What type of nerve fiber was involved? Remember, pain recovers faster than numbness or weakness. Is there true clinical weakness actually present in your muscles? And crucially, do the findings on your MRI actually match up with the physical symptoms your doctor is seeing during an exam? These elements dictate your healing far, far more than just counting the number of days you've been hurting. We also have to talk about something called central sensitization. Basically, if you've been in pain for a really long time, your spinal cord and your brain can literally become hypersensitive. They get so used to processing constant crisis signals that they kind of get trapped in a loop, just amplifying all those sensations. And let me be absolutely clear here, this does not mean the pain or numbness is imaginary or all in your head. No way. It is a very real, scientifically documented biological response. Sometimes, your nervous system simply needs extra time, targeted treatment, and a lot of support to calm down, even after the original physical compression in your back has been totally resolved. Now, while we've clearly established that numbness is slow to heal and requires a ton of patience, we do need to shift gears for just a second. We need to talk about the specific warning signs you can never, ever ignore. Patience is definitely vital for standard recovery, but there are certain nerve symptoms that cross the line from annoying but normal straight into dangerous territory. If you experience any of these red flag symptoms, please do not casually wait for them to improve at home. If you have progressive weakness in a leg, or something called foot drop, which is where you literally cannot lift the front of your foot to walk normally. If you experience any new changes in your bowel or bladder function. If you develop numbness in the saddle area, and that's exactly what it sounds like, the parts of your body that would touch a saddle if you were riding a horse. Or if your symptoms are rapidly worsening in a way that is totally different from your usual day-to-day pattern, you need to seek an urgent medical evaluation immediately. These are signs of severe nerve compromise.
All right, coming back to your standard recovery journey, assuming you don't have any of those red flags, of course, I really want to reassure you about timelines. So many patients walk into a spine specialist's office after months or even years of symptoms, having been told by someone along the way that they just waited too long. But here's the reality check. Two patients can have the exact same 5-year symptom history, but have completely different recovery potentials. Why? Well, because their imaging is different, their physical exam is different, and their specific nerve function is different. A long symptom history does not automatically shut the door on your recovery.
I want to leave you with this incredibly provocative thought from the Vertrae care team. Just because your numbness is lingering, and just because someone once told you nothing more can be done, that doesn't mean your healing journey is over. The science of nerve regeneration is super complex, and that 1 millimeter a day rule just proves that biology likes to take its sweet time. So given everything we've unpacked today about how nerves actually heal, is it maybe time for you to get a fresh evaluation of your recovery potential? Don't let the agonizingly slow pace of numbness trick you into thinking your body has given up. Keep learning, keep asking questions, and I'll catch you in the next explainer.